Hi guys, and welcome to another video. In this video we're going to learn about fractures, sprains and dislocations. So let's start. Okay, let's start with the definition. The definition of a fracture is disconsistency to the surface of the bone. The definition of a sprain is overstretching the ligaments in our joints. And the definition of a dislocation is when the end of the bone comes out of its natural place. Now, what are the causes for these things? The most common one is trauma injury. However, they can also happen as a result of an electricity shock, and surprisingly, they can also happen as a result of a sharp and sudden movement. Now let's go over the signs. The first sign that we'll probably see is swelling in the area. After that, it's going to be pain. Obviously, it's very painful when you fracture or dislocate something, as well as sensitivity to touch. We will also notice a different shape in some situations, a different shape in the area, and a different shade. Usually it will be a bit more bluish. And lastly, we will see a limitation in movement. Sometimes it's just going to be very painful for a patient to move that area, but in other situations he will just physically not be able to do so. Okay, now for the treatment. Now this treatment is generally the same for all of these. The first thing that you would want to do is to limit the movement. Okay, so basically to splint the area. If a person has fractured their arm or dislocated their shoulder, then he can by mistake move it, and then it will increase the pain that he feels, as well as it might make more damage. So that is the first thing we want to do. However, keep this in mind. The most important thing when splinting is to take care of how much comfortable is our patient. We don't want him to feel uncomfortable. If he prefers his arm to be lower, we will splint it lower. If he prefers to not even have any splint whatsoever, then we would not splint him at all. Okay, it really depends what our patient feels comfortable with. Next thing we would want to do is we would want to give him some painkillers. Now this one is optional. We don't want to give painkillers to a patient who has allergies to them, and we don't want to be responsible for anything. So that's why I personally really recommend only giving paracetamol pills. These are generally safe to use. I never give more than 2 pills to a grown-up patient. And I always ask if they have any allergies before giving them this pill. Next thing we would want to do is to evacuate them to the hospital. They would probably need some x-rays. They would need to find out what exactly happened and the doctors to treat their injury. Now keep in mind, some of these injuries might need a bit more treatment than what I just said. For example, if someone has an open fracture, which means that the bone is basically sticking out from the arm, then in that case he might need a tourniquet. We also might need to bandage the area around so it won't get an infection before we try to splint it. And also, when we splint it, we don't want to try and pop it back to place. We just want to continue with the new natural curve of the arm and splint it in the way that is going to be comfortable to our patient. Okay, now the next thing I want us to do is to watch some examples. Now keep in mind, a good first provider is a good improviser. I can show you examples of everything, but hopefully with these few examples you can get the principles and you can know how to improvise by yourself. Let's start with an example of how to treat a broken arm. Okay guys, now let's learn how to secure a broken arm. Now keep in mind, when we're trying to secure a fracture in place, our goal is usually to improvise. And we want to make sure that it doesn't move, that it is secured in place, and as well as it is comfortable for him. So we will not apply any force, and we will try to go with how he feels is best for him. Now, when securing a broken arm, what we want is to use a triangle. And the way we do this is we want to take it like this. We want to put it on his shoulder, and we want the point to go towards the arm that we want to treat. And now what we want to do, he will put his arm like he feels, and then we will take the other part and we will apply it to the other shoulder. And now, can you turn around for a second? Now what we want to do is we want to double tie this. So 1 knot, and if he wants his arm to be higher, then we can just pull it and just tie it harder. It really depends on how he feels comfortable. So for now, let's open it up a bit and do it like that. So it will be lower. And we want to tie it 2 times, like this. Now, turn around, please. Perfect. And now that his arm is in place, we still have this little thing in the back. So what we want to do is pretty simple. We want to take the rest of what we have left, and we just want to twist it. And now we just want to insert it in place where his elbow is. And that's it. Now, as you can see, his arm is secure in his place, and it should be fairly comfortable, is it?
Yeah, it's comfortable.
Perfect. And that is our goal. And this is how he gets to the hospital until they can put a cast on his arm. And that way, he feels better. This is how we secure a broken arm in place. Sweet. Now let's learn how to treat a sprained ankle. Okay guys, now let's learn how to treat a sprain. Now I'll be honest with you guys, I forgot to bring an elastic band for this shooting day. However, and this is kind of funny, I swear this is not an advertisement for the Israeli bandage. I don't care that it's called Israeli, it's just what I have. And the thing about Israeli bandages is that they are elastic. It's basically an elastic bandage, an elastic bandage with, with a mix of a personal bandage inside. So we can actually use this to help with a sprain. So let's learn how to do it. If our patient has a sprain in his leg, that means biologically that he pulled on his ligament too much, and it got stretched. So what we want to do is we want to create a new ligament, and we want to keep his leg as much in place as we can. We're going to create a new ligament using an elastic bandage to bandage it on the outside. Now, the way we do this is, first, if a patient has a sprain, it's generally recommended that he doesn't take off his shoes until he gets home. But sometimes it gets swollen up, and it really hurts to keep these shoes on. And so, in some cases, the patient might just take off his shoes because it's hurting him. So, I really recommend, if he can, to tie his shoelaces up, not too tightly, but tightly, until he gets home, and then he can take it off. Also, generally, if a patient is at home after he has a sprain, then he should put ice on it to cool it down, and he should lift his leg up and put a pillow or something below it to make sure that blood goes away from the sprain to his body. But now let's learn what to do in the surface. So let's say we were walking around and we were backpacking in the nature, and then he sprained his leg, and that he took off his shoe because it got swollen up and because it was hurting him. Let's learn what to do. Let's do that. Perfect. So in a situation like this, what we want to do is we first want to take our elastic bandage, or in this case the Israeli bandage, and we're just going to bandage around one round just to capture the bandage in place, like that. Perfect. Now, after I have it captured in place, now what I want to do is I want to draw an X. So I'm going to go behind his feet, and I'm going to keep drawing X's, you see? So this is 1x. And I will continue to do this. Now again, you want to pull on the elastic bandage, but you don't want to pull on too tight. At the end of the day, we don't want him to feel uncomfortable and we don't want him to be in more pain. We just want it to put somewhat pressure on it so it won't swollen up too much. So I'm just drawing an X. Can you see why it's called X? An X? Now, after I drew enough of these, I can just wrap it around and I can secure it in place. Perfect, and now it's secure in place. Now, again, after we did that, generally he should not step on his feet. He should not put weight on it. He should, when he gets home, he should put ice on it and he should leverage his feet with, so the blood will go away. Now, generally, we can't really decide that this is a sprain. We can't know if it's a fracture or if it's a sprain or anything. We're just treating it by what we think it might be. However, he has to see a doctor. At the end of the day, only a doctor can decide, and even a doctor needs him to do an x-ray to certainly say that this is a sprain and not a fracture. So this is what we do in both cases. Even if it's a fracture, this is what we're going to do, and then we're going to send him to the hospital to do those x-rays and to find out what exactly was the damage that he got. And that, guys, is how you treat a sprain. Now, when it comes to dislocations, I would say the first main part is to remember not to try to pop it back to place, okay? I want to tell you a personal story. I played basketball with a friend about a year ago, and literally while playing, he did a sudden movement, a sharp movement, and his shoulder got dislocated from its place. Now, when that happened, it was extremely painful for him, and he begged me to try and pop it back to place. Now, luckily, I'm a medic, and I knew that this would be a bad idea. I made sure that he gets to the hospital, and even in the hospital, doctors did not just pop it back to place. They first made sure that they gave him some drugs so he will sleep, and then they put it back to place. So remember, guys, doesn't matter how painful it is for your patient, just don't try and be the doctor and do things like that. Now, when it comes to immobilizing the area or splinting, it really depends on how your patient feels like. In that situation with my friend, I tried to take a triangle and try to immobilize it in some way, but it was painful for him. So at the end of the day, we decided not to do anything, and he just holded his arm like this when he went to the ambulance. So this is just a cool little story that I think will give you guys some context about how to treat these kind of things. That is it for this video. I hope you enjoyed. I hope you learned a bunch of new things. And that's it. I'll see you in the next one. Bye, guys.